Hi friends, now in today's video I'll talk about the recent JIPMER exam. Now in my interactions with we have had a excellent result of JIPMER this year. We have had like many students of ours cracking the top 20, top 50 in the exam. So we had good discussions with many of them, and I concluded there are some topics which I feel should be highlighted for a future aspirant. So what do what I talk to students, like what topics do you think are more important from JIPMER perspective considering the recent exam in mind? So I thought I'll try to highlight in this video those important topics for you. So first and foremost thing that I wanted to highlight is basic sciences. In JIPMER exam, basic sciences, they form a very important part. Out of the basic sciences, the most basic sciences, when I say, I mean the first second prof. Out of the basic sciences, the most important basic science subject is pathology. Pathology is very important as far as JIPMER is concerned. And out of the pathology, hematology has a significant role to play in the exam. In hemat, you will be surprised that there are visual questions in JIPMER which are peripheral blood smear based. That is very important to keep in mind, and many of them come with a clinical vignette with a visual, and you have to analyze that situation, which is very important to understand. And that takes us to the next core area to keep in mind. Genetics and genetic basis of disease is always there in the JIPMER exam. However, sometimes you might find the questions to be very tough, but I won't want you to not to panic in the exam. That is okay. If it is some tough genetic thing, it would be tough for almost everybody, don't worry. And that really doesn't matter in the real exam. Lymphomas, translocations, histological pattern of lymphoma, cancer syndromes, immunohistochemistry markers, hemolytic anemia. These are very important high yield topics from pathology, hematology as far as JIPMER is concerned. When we look at the other basic sciences where we would talk about first prof subjects, there are injuries where they would talk about the anatomical, the applied aspect of the injuries. Like there will be some injury, but the answer will be possible even if you know the anatomical aspect. Embryology, there are one or two questions on embryology every time. There will be calculation based questions in physiology, like total body water, cardiac cycle, electrolytes in physiology. There will be questions on, there are usually, they would go towards the calculation based questions. There are sometimes they ask questions about which arrange them in sequence, which is a new buzzword, especially after so around such a pattern. Metabolic pathways like TCA cycle, glycolysis, there are questions on these topics. When we talk about diseases, rare animal bite, bioterrorism, classics like antibiotic resistance, classics like AIDS, Zika virus, vaccines, they would always be important for exams like JIPMER. Pharmacology, the big buzzword in pharmacology is, some question related to monoclonal antibody is usually there. New drugs are very important. Not only that, drug interaction, teratogenic drugs, these are important from exam perspective. Then when we talk about medicine, there are visual questions in medicine, especially on ECG as far as exams. And you have seen in DAMS, we have created a special ECG course for you on eMedicos, keeping the central exams in mind. And then, in JIPMER, they go towards questions like cardiology and respiratory diseases. More respiratory is a very important topic for JIPMER. Genetic basis of cardiac disease is important. How to look at JVP, antiarrhythmic, stroke, Alzheimer's, epilepsy, anti-epileptic drugs, antibiotic associated diarrhea, all important topics. Well, breast reconstruction, cancer staging, general surgery, in surgery, and in Obs-gyne sometimes they would ask you questions on medical disorders and pregnancy, and the questions would be specific to the management. It would not be the classic pregnancy, it would be some medical disorder with pregnancy that happens. In other central exams and JIPMER, there is a difference. In JIPMER, the radiology is more asked, and they would have some rare neurological disease being asked, something to do with cardiac isotopes. Chest x-ray is a very frequently asked question, and it is again different from other central exams where they don't ask technical questions. In JIPMER, they also have technical questions. This was in a nutshell the key differences which I feel were when I talked to students, the topics that they kept mentioning. I thought these are the important topics to be told to future aspirants when they are appearing for the next JIPMER exam. And I also want you to know sometimes the JIPMER exam is on a tougher side, but you have to always keep telling yourself if it is on a tougher side, it is tough for everybody. So you have to maintain your cool. monoclonal antibodies, genetics, hematology, peripheral blood smears, chest x-rays, ECGs. There are a few visuals in the exam, not too much, but they are there. Don't underestimate them. But then again, you have to bet on yourself. You have to bet on your notes that you have enough in you to rule them out. Rule them out. You have to try to rule out diseases, get to them, and keep following us on different media of e-medicos and YouTube, where we keep trying to add more and more diseases to your understanding. We keep trying to do that. Any exam at the end of the day is competitive. It is not about you and the examiner, it is between you and other candidates. If you do better than others, you will rock. I wish you all the best. Thank you.